So I actually, I've interviewed some people. I actually helped my neighbors with various video visits and whatnot. Where do you think these things fall down? It's interesting to me because my neighbor's video visit fell down because, he was using an AOL browser. I mean,
Mm,
literally,
wow.
that's what he was using. And so he struggled, but we got through, and it would have fallen down again because the clinician was 17 minutes late to the appointment.
Yeah.
And I wonder
Yep.
how many of those are happening.
Yep.
And based on your experience, based on what you're maybe hearing from your friends, neighbors, or whatever, where do you think the best opportunity to improve the telehealth workflow and visit is in order to ensure that the connections are being made and it's not a technical issue anymore?
Well, the first thing I thought when you related that story was using AOL as a browser is probably the best indication that you need help on your
I know,
telemedicine.
seriously. It's like, what is your
Like it
browser?
is probably those how are you going to connect questions,
Yeah.
right? Do you have your own computer? No, I'm going to use my neighbor's. Or what browser are you using? And do you know? If you don't know what browser you're using, that's probably another good indication that there's a problem. I think you're absolutely right. The wait. I mean, I haven't done a telemedicine visit since the beginning of the pandemic, and it was the wait time where I think that's a problem with technology in general, or even being on hold for a health system, is at what point do you know that you're actually still actively on hold? I think those services that call you back when they're ready, those are some of the best ones, because you don't have to listen to hold music, keep refreshing, hoping you're not losing your internet connection, like all of those things that can go wrong. Sadly, I think a lot of it is actually the technology. And we spend a lot of time on the real-time video and not on the things around it
Right.
that like help you understand. And I still see this. I'm still amazed how hard it is sometimes to get into a video call or a Zoom call. There's just like these little bits of friction. And I think every time you have one of those bits of friction, then, there's the risk of people abandoning it. And then, the doctor's running late, which we all know happens.
Yep.
That's an interesting one. That's a question of staffing. And that's where video visits, the doctor should never be late. Because if you have a pool of people, you should be able to optimize for who's available. You should have
Right.
people only doing telemedicine, for example.
Right. But it's specialist, it's a follow-up visit. So it's got to be that person. As I was thinking about that one, because I have thought about it a bunch, if we were going to optimize for that, there should be whatever the equivalent of waiting music is for a video visit. And actually, I don't think it's waiting music. I think it's an active presentation on some aspect of their information. This is where we get to the N of one, the personalized experience. Their hold music, if you will, is a presentation on their case or their symptoms. I mean, not specifically, but on things they can be doing and that kind of stuff.
Look at those companies that made so much money doing the waiting room video.
Right.
This one, you could you could do it for an N of one because you know who the person is.
Exactly. And the other thing is,
I'm going to go do that.
I'm wondering how hard it would be.
Let's do that, Bill. Let's create this business.
Oh, here we go. Now we're off. Now we're starting a new company. No, but I'm also thinking there's got to be some way you're on a Zoom call. Well, we now know that Zoom was the number one used platform for telehealth visits based on data that's been collected, millions of records and whatnot. Yeah. So Zoom was number one. There has to be a way when you're on hold to have something come up there that says your physician is, you will be seen by the physician in 15 minutes. Those call trees where they say you're the next caller online or that kind of stuff.
Yeah.
I don't know how to do that, to be honest with you, because the schedule for these specialists is so dynamic.
Yeah.
I don't know. But anyway, it's good problems to solve is making the experience better, getting as much feedback from the user community as you possibly can, and then looking at the tools that are possible around that.